The launch of Child Protection Week happening, and the Deputy Minister is at the lectern. Let's listen in.
Even knowing the status, sometimes to remove children and declare them children in need of care and support. You can already calculate for yourself. The madness was very unsustainable because we just don't have enough facilities to look after children. So it went between the scientists and health and doctors about a disease. Nobody seems to know what on earth is going. No, children must wear the masks. No, they mustn't wear them. Children are going to infect each other. No, they are not going to. And obviously, we closed the schools and we send children home so that we are able to get our head around that. But what did we send the children back to? We sent them back to a home where there is no food, because the school nutrition program did not follow the child home, because you eat at school. And now the school is not there. And that increased hunger amongst children as a form of protection. But we also closed the crèches, the ECD centers, and the 4 meals the child eats, the child didn't take it with. So as we use ECD for child protection, as we use ECD to fight malnutrition, stunting amongst children, COVID showed us flames because we could not do that. What became a priority is ensuring that ECD practitioners' salaries are paid so that as and whenever the ECDs shall be open, there would still be somebody, a caregiver, that will take the responsibility to look after children. A lot of jobs became redundant as we're celebrating digitalization, connectivity, spectrum availability, broadband, and all the fancy things. And we all woke up knowing how to use Teams, Zoom, WebEx, whatever you call it, even Facebook, even Instagram, YouTube, you name it. Let's not forget TikTok. So the world changed at the snap of a finger. But as that world changed, parents knew little about technology. And children, because you don't have to teach them, thrived. And they did everything and anything unsupervised. They bullied others. They watched programs that were supposed to have the classifications, PG, 14, whatever. Because if we were not moaning about the alcohol we don't have, we had totally never remembered that children at home need to remain engaged. What did they do? They went and watched pornography and practiced it on each other as siblings. Because as parents, during the lockdown, firstly, we had to deal with our own coexistence. We've been married for 30 years, but actually, we've only been married for 30 days. Because every morning you wake up, you go this way, that one goes that way, that one comes back late, and for the first time, you now need to get remarried. So you get obsessed with each other at the expense of protecting the children. So they were there, invisible, unheard, because these two people that said they love each other could not extend the protection. But something else happened That's the time where my own confusion and my own clear declaration that I shall never live in a gated community. I think COVID helped me affirm that it was the right decision. Because as children reached out for help, the social worker can go only as far as the gate of the estate. Yes. The police could only go as close as the security gate, even though they are the South African Police Service. Because some number of some house must be pressed. And if they choose on that day not to answer or even press and acknowledge you at the gate because the children are sitting there while the father is beating up the mother. And even if the children reached for help, the security men at the gate in that estate had more power to decide whether those children will get the help or not. And the truth of the matter is, a lot of children did not get the help because their parents chose to live in a gated community and never remembered that one day they will not be in love with each other. There won't be baby, honey, sweetie. There will be, wait, sauce. And the children are at the receiving end of all of that. But as the world came into this abrupt standstill, the impact COVID had on refugee children, stateless children, undocumented children, asylum-seeking children, separated children, trafficked children. And don't take trafficking and think it was about the borders was closed to DM, who was, no, we traffic you next door. Out of your home, you just cross the fence and you are trafficked next door. But what also happened as this list of children was homeless children, children who live and work in the streets, and children who live in the streets. By virtue of being a child, you are already, by law, a child in need of care. You being a child alone is good enough because you need to be looked after. But when you are unaccompanied, and then you are undocumented, you automatically are already stateless. But it's important that we understand as we go into the protection of children, that being undocumented in itself doesn't make you stateless. You are undocumented here in South Africa. But like one of the children that spoke, or the young people that spoke here, he had a passport. So he was documented where he came from. And he was transported. And at 16, he's still a child. And he came into South Africa and became a child in need of care because he is not on our population register. And what is the first thing we need to do? Is to find the people listed on that particular passport as the parents and try and trace and send the child back home. What does the law say about that? The law says you cannot, as South Africa, the Children's Act says, you can't take a child back to their country unless you have ensured that they will receive the same or equivalent thereof care from where they come from. And that's a section half the time we don't understand. But we also know that refugee children are entitled to everything that is given to a child that is a citizen of the host country. In the same spirit, a child who's an asylum seeker, once their asylum has been granted, they are entitled from the child support grant, Kasasa, to care, you name it, to education, they are entitled to all of that. But when a child is stateless, and we have a lot of those in South Africa, not because they don't have documentation, they have. Because the Zimbabwean woman who must pay from the bandage to the needle and paying for the birth itself would cross the border when she's 8 months pregnant, because South Africa is going to grant her the opportunity to give birth without pay. But South Africa will also grant her child the opportunity to have a better future. And we've heard from the young persons, the mother was there. And that doesn't make them a child in need of care. But that child cannot get a birth certificate from South Africa. What South Africa does is acknowledge the birth. And as we launch Child Protection Week, one of the most important campaigns we as social development need to drive, together with Home Affairs and Health, is to educate women, foreign women, of the importance of that piece of paper. Because that child remains stateless until such time that the holder of the recognition of birth document can put the child in a population register. So we give mothers the recognition or acknowledgement of birth as a confirmation that says, we know this child, we acknowledge they were born at a Benoni clinic, at this time they were weighing this, at whatever time. Until the mother crosses the border to Lesotho and puts that child using that paper onto the register of Lesotho, that child remains stateless because the child belongs to no country. And one of the weaknesses that leads to us thinking to 18 is the fact that as she goes begging, as she moves from whatever to whatever, she loses that piece of paper. Because that piece of paper, when this child turns 18, the child has the right to citizenship by naturalization. Because I was born here. And the reason why it happens after 18 is to create an environment where the child can choose. Because in other countries, we don't have dual citizenship. So once I am in that country's population register, it means I am going to struggle to get documentation. So stateless children in itself, it's not something that should happen. But as it happens in the value chain of human rights, there is always that silver lining, that when that child comes of age, that child will be able to choose where they want to live. So it's important for us as social development to strengthen that element, Because even if this child is not born here, immigrations allow you, after 5 years, to apply for citizenship. After 10 years of being here, to apply. So it is important for us and for all of the NPOs, including places like Kids Haven, that the documentation of the first person that made contact with the child is proper. Because that is what Home Affairs needs to be able to determine whether they can grant that child that naturalization resident according to the different classifications. Now, as we bring these children that falls in this category, it is important for us to never forget that you do have trafficked South African children. For the same reasons of the children in Lesotho. Sexual exploitation, domestic work, farm work, and by the way, South Africa, always be interested in knowing the family of the person that looks after your own children. Because when they come to look for that bread to feed, it means on the other side, their children are motherless. And by virtue of their mother having left Maseru, Kapa Mohali City, to be a domestic worker in South Africa, do take the time, even if it's just a minute, to find out, do you have children? Who is looking after them? Where are they? Because our inability to do that is also what exposes our resources and create a value chain of children in need of care. Because the mother might be working in my house, but her children might be here at Kids Haven. Not because the mother is irresponsible, but because the mother left them alone in Orange Farm, in a shack, to go and be in my mansion. And when the social worker and the police come, they bring them to Kids Haven. And it is easy for the mother to know where her children are and never come to claim them. Because here, they will get the services that she is unable to give them. So as we roll out services for this category of children, we also need to ensure that we don't create anarchy and unhappiness amongst the children of South Africa. Because it is this bitterness that leads us to phobic attacks and high levels of intolerance. Where we have a basket of services to service unaccompanied, undocumented, separated, to the extent that it becomes not okay for poor parents in South Africa, where the children from others get more than what the children of here get. So for social development, we always need to play the balancing act. Like correctional services having to play and ensuring that prisoners' rights, even though they are there, they are not above the ordinary law-abiding citizens. So finding the balance, it's also child protection, because you're managing resentment. You are managing bullying in school. Because when we, by law, provide the free uniform to the child from Burundi, while the South African child does not have that uniform, that child will be bullied at school that child will be humiliated at school. While at school, in the value chain of bullying, this child will have more than what? And resentment, anger, xenophobic, intolerance grows. So as protectors of children, we must never forget that it is in the balance where we find the long-term protection of children. Let me declare the week launched, the month launched, the year launched, the commitment made, and the further abet will take place, especially in the technical background, legal and policy and guidelines for this category of children. Let us elevate them, empower them, support them, because it is in us being able to protect children, providing child-friendly services to them, but never ensuring that they forget that they belong in the same cycle of life. And they are born from the same fabric. They are first and most Africans, then South African. And this whole continent is a home to each and every child. So let's look after children. Let's protect the mental health of children. But above all, let's remind children that they are important, they matter, and they have a contribution to make. Ke a leboga.
Wow. Thank you so much, dear. I think we heard you saying that we really need to strike a balance between our South African children and the migrant children, just to manage the issues of resentment. I'm calling upon Tsidi Maha to come and do vote of thanks. Oh, Tsidi.
Good afternoon. I'm told it's only 2 minutes left and I wanted to sing, but now time is against me.
All right, first introduced in 1997, Child Protection Week is a campaign held annually across South Africa to engage and educate the public to play their part in keeping children safe in families and their communities as well. Under the theme, let us protect children during COVID-19 and beyond. You heard it from the Deputy Minister there, about COVID-19, which has negatively affected many families. And children are not spared as they experience abuse from their parents, for instance, teachers, guardians, peers, and the community members as well. So we need to look out for this. The week-long campaign will run from today until the 6th of June.